Now, what does this bill mean to you? Everybody in South Carolina who makes under $75,000 a year will be getting $1,200 as an individual, $2,400 as a couple, $500 per child. That is a lot of money, but it will help keep the lights on and the refrigerator stocked. If you're on Social Security and you haven't paid income taxes, you get a check. If you're on disability and you don't pay income taxes, you get a check. This money is coming. It's going to take a couple of weeks, but it will be coming. There's $150 billion in this bill to help states and municipalities and counties that have had to spend money they never allocated to deal with this virus. We've dealt with hurricanes very well. This is a hurricane that's not going to leave anytime soon. So this $150 billion will be a godsend to the state of South Carolina to replenish the coffers. There's another line item that is very important, $16 billion to buy the supplies we need to win this war. The special forces in this war are your nurses and your doctors and your healthcare professionals. They're the ones that meet the disease every day head on. The rest of us are soldiers in this fight. The war on terror, 1% of us have been fighting that war. The war against the virus, we're 100%, we're all in. What can you do? Follow the guidelines. This disease will be starved if we follow the governor's guidelines. It needs humans to transmit itself. The more we follow the guidelines, the more we starve the disease. Finally, there's sort of a war going on here between the virus and trying to stabilize the economy. Here's, I think, the strategy to destroy this virus. Between now and the summer, we're going to have to really focus on good containment policy to keep the virus from spreading. The more you do your part, the sooner we'll get out of this. Eventually, sooner rather than later, we're going to have therapies, Dr. Bell, drug therapies that will whack the heck out of this virus, that will make it less lethal, that will take it from a 10 to 1 or 2. And hopefully by the fall or the early part of the next year, we'll have a vaccine to kill it. Between now and then, it's going to get worse before it gets better. We're going to have an economy locked down for a while to come, and we'll reopen it based on sound science. The worst thing possible is to try to create a bump in the economy that leads to a spike in the virus. Heat is an enemy of this virus. I'm hoping we'll get some relief in the summer, but I know it's coming back in the fall. And the more we do now to get ready for the fall, the better off we'll be.